Good evening, everyone. Thank you so much for joining us. We're very excited to have you all here. And hopefully you get to know a little bit more about us and more about how you can partner with us to take care of yourselves on your healthcare journey.
Yes. We are here to introduce primary care. For those of you who may not be real familiar with that term, primary care is basically the provision of comprehensive, accessible, and continuous healthcare services aimed at addressing a wide range of healthcare needs for individuals and families over time. It serves as a first point of contact for patients seeking healthcare services and encompasses preventive care, acute care for common illnesses and injuries, chronic disease management, such as blood pressure and diabetes, health promotion, and coordination of care with other healthcare providers and specialists. At its core, primary care focuses on building strong doctor-patient relationships and provides personalized, holistic care that considers not only the physical health, but also the emotional, social, and cultural aspects of each individual. Primary care physicians, often referred to as general practitioners, family physicians, internists, play a central role in delivering primary care services and act as advocates for their patients, helping them navigate the healthcare system and make informed decisions about their health. So overall, primary care serves as the foundation of the healthcare system, promoting health and wellness, preventing disease, managing chronic conditions, and addressing the healthcare needs of individuals throughout their lifespan.
This is going to be the outline of what we're going to talk about today. So one of the big roles, kind of as Dr. Meissner-Frisk already mentioned, is that primary care functions really to partner with our patients and to cover a wide variety of parts in medical care. Really, our goal is to personalize our medical attention to each of our patients based off of what their respective goals are. We collaborate with our patients as well as other medical specialists to make sure that ultimately we are reaching the healthcare goals that you're trying to achieve. A big component of primary care is focusing on preventative care. The reason that we focus so heavily on that is kind of one thing that my patients will hear me say a lot is there's a lot of things that we can do to keep bad things from happening. But once things start not quite working, it gets a lot harder for us to prevent those progressions down the road. So we really, really focus on trying to make sure that people's quality of life is as optimal for as long as possible by doing a lot of our preventative measures. And we'll talk a little bit more about that later on. Other things, as Dr. Meissner-Frisk already touched on, we do address common illnesses. So your good old flu and cold, minor injuries, obviously chronic disease management, such as diabetes, high blood pressure, cholesterol, kind of the myriad of things that can come up. Another big part is health promotion. So we're very strong advocates of preventing things and making sure that people are living a well-balanced diet, healthy lifestyle. And that's a big part of our practice. Again, trying to focus on making sure that people have long quality life so they can do the things that they want to be doing on a daily basis. And as I mentioned before, coordinating care with other healthcare providers, whether that's specialists, whether that's home health, whatever kind of other partners that we work with to make up the team of your healthcare team to make sure that your quality of life is exactly what you're hoping for.
So we believe that enhancing access to our medical community enhances overall well-being. So accessible medical care allows for early disease detection, which reduces the burden of illness and promotes a healthier population. We aim to foster the health equity in all by providing the opportunity to receive essential and personalized medical services in the hopes of contributing to an improved quality of life for our patients. So, as the slide said, that includes prevention, timely access, which will improve health outcomes.
Continuing that, I mentioned previously health promotion. So it really is us trying to create an environment that when you are having an appointment with each of us, that we are supporting your overall wellness. And that is both as a physical wellness as well as mental well-being. They all play close relationships to each other and really fundamentally can affect how people's overall health is. A lot of what we also do is preventative measures, including vaccinations and screening. So, as I'm sure all of you have heard many a times when we'll talk about getting your annual mammograms or lung cancer screening, colonoscopies. Those are all the things that help us to promote health overall wellness for our patients. And another big part is I like to view our role as being educators. So we're here to provide information to help guide patients to ultimately make a decision that really fits with their healthcare goals. So we love when people ask us questions. We love to provide information to really make you feel empowered that you're making a decision that really fits what your overall healthcare goals and needs are.
So in summary, our goal is to empower patients to take control of their own health, which we help them make informed decisions and create conditions that can support a healthier lifestyle, which ultimately prevents illnesses along the way and enhances their overall quality of life for a long time.
So one of the main things that patients will come in for is our annual checkups and wellness visits. Obviously, there's also, the sick visits and the problem visits where people have acute concerns. But our comprehensive health assessment is really the cornerstone of what makes sure that we really get to know you as a patient, get to know your past medical history, understand what surgeries you've had, medications, family history, really get to know kind of who you are. That also includes physical exam. Times we will order tests, so lab work to make sure that everything's functioning how it should be. As I mentioned before, screening, that is one of our favorite things. And it really is because our goal is to make sure that we catch these things as early as possible, and we're making sure that we're not getting surprises down the road so that, again, you can live the quality life that you want. Other things, so lifestyle behavior assessments, that really is talking more about, diet, exercise, sleep, stress management, really taking in a holistic approach of how we can target good health habits. I mentioned previously, mental health is a big component of our assessment as well, because it does play a huge role in how our physical self is as well. We also make guidances and recommendations for immunizations, preventative screenings, as I mentioned before, and making sure that we're doing that in a collaborative nature. Other things, as I mentioned, also patient education, coordinating care with other specialists. And I think really one of the important things is coming up with a plan of how we're going to make sure that we're managing your health long term. I like to tell patients that we're a partnership. This is meant for us to work together to really get to your goals. And I'm like a tour guide to get you to where it is that you want to be. And we work together, and that I think allows for a very lasting relationship that really can empower patients to be in charge of their health, but also to feel like they know, okay, this is what we're working towards. Oops, sorry.
So developing a plan includes some of the things that you see on the slide here. So through routine checkups, physical exams, labs, imaging, we can understand how a condition is evolving over time and assess any changes in symptoms. We can then provide personalized adjustments to the treatment plan, such as modifying medications, dosages, or introducing new therapeutic approaches based on the patient's response and changing healthcare needs. So if not managed effectively, chronic conditions can lead to complications that are more difficult to treat or impossible to treat down the road. So this is just partly how we try to mitigate that risk. I'll just run through these bullets. Medication management and prescription refills includes the monitoring of the effectiveness of the medications and addressing any side effects, or if there are adjustments needed. We monitor and track progress over time of that chronic condition, continuously assessing the impact on the patient's overall health and adjusting their treatment plan as necessary. Early detection is kind of the key of so many things that we stress, but early detection of potential complications or changes in the condition allow for timely intervention. Health education is so important, and every visit includes education. So regular follow-up provides opportunities to enable patients to better understand their condition and ask questions, adhering to their treatment plans, and make more informed lifestyle choices. Emotional support. We aim to provide a constant support system, allowing patients to discuss their concerns, ask questions, and receive whatever emotional support they may be needing. We like to think of this as a partnership and not just something that's being done to them, but we want to hear from them as well. Connection includes, coordinating management with other specialists, which, we're aiming for seamless healthcare down the line. Communication with each other, whether they're seen in the ER or urgent care or other specialists, we try to communicate well to keep the patient, to give them a seamless and effective experience with their healthcare.
So working with your primary care, really fundamentally, it's a long-term relationship. And one of the importances of having that continuity of care is because it really allows us to get to know you, one, allows us to kind of work through each of these health concerns together, keep that information seamless between our appointment to appointment, between specialists, hopefully not very many hospital or ER visits, but basically it allows for everything to be housed in one place, and to make sure that we are able to keep track of what's going on and minimize long-term issues as much as possible. It also allows us to have a comprehensive understanding of a patient's medical history. So if you're going between seeing one doctor and then another, there's a lot of stuff that gets lost when you're recounting things again. Whereas having a long-term relationship with your primary care doctor, it really is that lasting connection that they get to know you on a personal level. And then when we're making recommendations or when we're talking about how treatment plans or how next steps factor into your life, you really have an understanding for how this plays into that person's life, how it's going to affect them on so many more levels than just healthcare. And it also allows us to create a collaborative and coordinated approach. As I've said before, it's a partnership, right? You are trusting someone with some of your very personal information. You are allowing us into your world and giving us the privilege of taking care of you. And it is a very intimate connection, and it's something that can have a very big impact long term. And so our whole goal is to make it feel like someplace that is safe, welcoming, and that we're on this journey together for the long haul.
So building a long-term relationship, I'm just going to read this first paragraph because it kind of summarizes everything right there. Developing a trusting doctor-patient relationship. We are committed to not just building relationships, but partnerships with our patients that are based on trust, effective communication, mutual respect, and shared decision-making. We're committed to providing an approachable environment that works with the patients to develop individualized plans for their health. We like to think that a strong and supportive physician-patient relationship should be thought of as a partnership and aim to provide a positive environment for open communication, empathy, attentiveness. And we're also committed to staying informed through continuous medical education, not only to maintain our competence, but to ensure that we're providing the most top-notch, high-quality care our patients deserve. Through effective communication, regular monitoring, and shared decision-making, we can provide the most accurate diagnosis, the most optimal and timely treatments, and improve treatment outcomes and patient well-being. We try to listen to our patients too, who come in with lots of information that they've heard, and try to sort out where the information comes from and ways we can either integrate it or not. But it's a shared decision-making with mutual respect.
Another big part of that long-term relationship with your primary care physician is when people do have chronic medical issues that we're managing. Really, our goal is to work very closely with our patients because chronic issues, unfortunately, are, as the name says, they are lifelong and constantly fluctuating as people go through their life. And so having a good relationship with your primary care and vice versa with our patients really allows us to work collaboratively so that we can optimize treatment plans, we can talk about when changes need to be made, and really make sure that the plans that we're setting up together are fitting in your life. Medicine is lots of science, but also a lot of art and a lot of communication and a lot of just humanistic connection. And that's what makes it beautiful when we work together and we're able to come to plans that really make people feel empowered and they don't become defined by these chronic issues. It's really giving back that sense of autonomy to our patients and making sure that we're being proactive, that we're supporting, and that we're making sure our patients feel like they have a good understanding of what the future holds and how they can continue to live the quality life that they envision for themselves.
So looking toward the future, we foster a culture of innovation by involving our patients, other healthcare providers, and administrative staff in the decision-making process. We encourage idea generation through regular team meetings, feedback sessions, and collaborative brainstorming. Through our partnership with the Cottage Network, we are able to leverage data-driven insights to enhance preventive care, identify high-risk patients, and tailor interventions at the individual level. And our goal is to optimize patient care by improving efficiency, communication, and overall patient experience. We conduct comprehensive analyses of existing workflows, technologies, and patient engagement strategies at regular intervals to identify these areas that need to be worked on for the optimal experience for the patient and the best clinical outcomes.
More things looking for the future. So technology obviously plays a big role in healthcare. And Cottage does take that very seriously and are very committed to staying informed about emerging technologies, regularly updating the business plan on how to incorporate these new technologies, really to make sure that we're aligning with the mission statement of Cottage, as well as providing or prioritizing patient data security. So the electronic health record is really our mainstay, and that's a big part of keeping patient information secure, but then also allowing patients to have access to their health records and have access to communicating with us. Other things are exploring partnerships with technology vendors and research institutions that can provide expertise in providing our patients with some cutting edge solutions. So again, that's looking through part of our EHR, as well as with telehealth optionality, EHR communication platforms, scheduling, all of those things that are really trying to make access to healthcare easier, as well as easier to understand. Because it's a lot. It can be a lot to digest. Our clinic also aims to practice efficient utilization of technology by integrating electronic solutions to streamline processes and improve patient care to enhance overall efficiency. And that really looks at incorporating telehealth and video medicine appointments, because we all have very busy lives. And sometimes that is the way that we can connect with our patients, and our patients can connect with us so that they can get the information that they need. And that's also, talking about the EHR, as I mentioned, with the portal, is a big tool that has allowed us to be connected with our patients, as well as allow them to see their lab results, have access to their chart so that they can see notes, imaging results, really allows them to have access to it at any time. And then being able, as I mentioned before, to schedule appointments. Our online platform to schedule appointments makes it very easy, so patients can look at their schedule and schedule it at their convenience versus being held on the phone trying to schedule it while also looking at your calendar. The idea is really to make healthcare accessible to all of our patients. One of the other big things that we're looking forward to in the future is that the Cottage Health Primary Care St. Inez Valley Clinic will be incorporating pediatric care. Both Dr. Meissner-Frisk and I are family physicians, so our scope of practice includes taking care of the little ones in this world, which we are both extremely excited about. We love taking care of all of our patients, but kids just bring that extra spark of fun into the office. So we're very excited for that to be in the near future.
We both went into family medicine because we want to see birth to the end. We want all patients at all stages in their life, and we welcome all ages, or we will be very soon.
And the other thing too is that we're in an area where healthcare is, we have access to healthcare, but we are in a critical need area, both for adults as well as pediatric care. So we're very excited that we're able to provide that pediatric care in the near future, as well as adult care for all of our local community members, because this is home for us too. So it matters a lot. Thank you all for joining us, and we are excited to hear what questions you have for us, and hopefully give you lots of information through our answers.
Thank you both for that wonderful presentation. And so now we'd like to open the room up to questions. As a reminder, please submit your questions in the Q&A box, and I will go ahead and read them out loud to the doctors. So our first question for you ladies is, what sets cottage primary care apart from other PCPs in the Valley?
I guess I'll go first on this one. We're gonna ping back and forth and probably both chime in kind of on our different perspectives. Cottage, so we both worked in very multiple different practices. I think one of the things that Cottage, that really drew me to Cottage and why I'm very proud to work for this organization is the real strong focus on making sure that our patients really feel like they're part of this family. Cottage is very focused on making sure that patients have a wonderful experience from the second you come into the door to when you leave at the end of your appointment. And I think that's a really, really important thing because, as I kind of mentioned before, healthcare can be daunting. Coming to the doctor's office can be terrifying. And we're biased because we love our jobs. But that shouldn't be the experience. Like, people should not be scared to come into the doctor's office. This is supposed to be a place that you feel accepted, you feel safe, you feel like you have a team behind you. And I really feel like, just with everyone I've worked with and just the mission of Cottage as a whole, that is true for the people that I work with on a daily basis, and it just naturally blends over into how we take care of our patients.
There are other healthcare organizations, but I grew up here in the Valley, and Cottage Health, whether it was a hospital or now the clinics, has always had such a stellar reputation. And I feel so privileged to be back here working for Cottage. And I think some of the things that we were touching on earlier in the presentation about access, timely access to care is so important. And we both try to keep same day spots open every day just for urgent things that may come up, so that patients don't have to wait months or weeks, to get in for an urgent problem. We also work very closely with the urgent cares, there are numerous throughout Santa Barbara County, for after hours or weekends. We work seamlessly with them. They send us all their notes and labs and x-rays and whatever they've done immediately, so that we know at all times what's going on with our patients. The ER is the same. So by being in this cottage system, it's a very comprehensive care system where patients can receive care pretty much 24/7. And whether it's from us or the urgent care or ER, or through a same day visit or a regular appointment, we try very hard to keep everybody cared for the best way possible.
Great, thank you both for that. What's the typical wait time that a new patient has to wait to be seen by either of you or a physician in your practice?
Let's see.
I think I'm booking out 3 or 4 weeks. But again, we try very hard to keep a couple slots open daily, one in the morning and one in the afternoon, for someone to call for an urgent visit that morning. And so for regular appointments, maybe 3 or 4 weeks, but for urgent things, hopefully the same day.
Depending to how long. So I just joined about a month ago into the practice, so I'm a lot more open. So I get same days like that week or a few days. But I know some of my colleagues who are here, sometimes it can be a few weeks if they have a bigger panel already established. But kind of already, as Dr. Meissner-Frisk mentioned, our goal is really to try to make sure that we have the ability to see our established patients same day for acute visits, and really minimize the time between. Because the last thing you want to say is, "Okay, bye. I'll see you in a year," or can't get you in. That is like soul crushing to us. So the goal is really to minimize that as much as possible.
We also have a wait list you can ask to be put on if you want to be seen sooner. And sometimes if those same day slots aren't filled, they'll call you and say, "Hey, come on in," So.
Great, thank you. That's very informative. Dr. Meissner-Frisk, I think this question is specifically for you. Can you share with us what it means to be a DO?
Sure. DO stands for Doctor of Osteopathic Medicine. And, for patients being cared for by an MD versus a DO, most of the time they don't know there's a difference. Oftentimes, ER urgent care patients don't know that they're being seen by a DO versus an MD, because our medical training is essentially the same. Our licensing is the same. However, DOs also are trained a little bit more holistically in musculoskeletal things and how that might affect the body. So MDs are trained holistically too, a little more now than previously. So we're all trying to do the same thing and get our patients the best care possible, with the main difference being our extra training in musculoskeletal issues. Some DOs will choose to include that in their practice. DOs specialize in all the same things MDs do, whether it's OBGYN, surgery, or neurology, or whatever. And some will use manipulation or musculoskeletal techniques in their practice. Many don't. Others choose to just do that as their practice. And I would say, for those who don't know, manipulation is similar to chiropractic, but not the same. It's working with the body where there may be pain, where there may be pinched nerves or circulation deficiencies, to optimize health in that regard. And so often it's added to whatever specialty they're already doing, or there are DOs that just do that as their practice. but we're all pretty much licensed and educated the same otherwise.
Great, thank you. And so how does a patient go about making an online appointment with you? Do they first need to establish an in-person visit?
I'm not sure. That's kind of new for us here.
I think what I have seen for the online appointment, if you go through the main website for Cottage, then there is a way once you click onto our clinic, our names pull up and then you can fill out the information. And then it gives you all the different appointment availabilities and then kind of gives you optionality to answer some questions about kind of what you're coming in for. And then that gets transferred over into our system on our end. Sometimes our MAs will reach out if there's like questions about kind of what it is that people are coming in for, or if there's something like more specific. But that's, I think, the way it's launching. It's been going now for, I want to say, a couple weeks that we've launched. And so far it seems to be working well.
Great, thank you. Does this practice offer pap smears or offer women's health services? Could you speak a little to that?
Yes, we definitely do. So pap smears, well woman exams are both within our scope of practice. We do contraceptive counseling as well. If there's anything that we feel would be more appropriately handled by OBGYN, we have that conversation with our patient. But majority of things we're able to handle in office in one place, which is kind of nice if you don't want to be going to multiple providers. But obviously that's a conversation that we have, and it's very individualized based off of patient preference.
Also, some of the men in our practice will send their female patients to us just for their well women checks. And that's fine. We all work together. We all have the same goals, for patient health here. And if a woman feels more comfortable with a woman provider for that sensitive exam, they're willing to do that too. But we're also willing to see those patients that may want to be seen by a woman.
And I guess along those same lines, would that include like hormone replacement therapy or any medical care for menopause?
Yeah, definitely does. Again, that's a conversation. We have a conversation, kind of what their goals are, kind of what they're experiencing, and then we talk about different options because there are a lot of options out there for how to manage all of these things. But that's definitely something that we can do.
Great. We have a really good question. How can patients better prepare for appointments to make the most of the limited time that they do have with you during a visit?
Okay, so the one thing that makes things super, super helpful, if you have a medication, like if you have medications, having a list of those medications that you can bring, it makes it so easy because then you hand the list over, our MAs can put it right in, and it just cuts the time down dramatically. And same thing if there's like past medical history or surgeries, especially if it's like a long list. If it's one or two things, you can get away with just telling it verbally. But some people have extensive history, or they're transferring from a place where we can't get medical records for one reason or another, or it's not part of our shared system where we can see what's happened in that hospital. And so that can make it very challenging when we're trying to piece together, 20 years of history in a short visit. So that really helps to expedite a lot of that background information on our end.
I think you're on mute, Dr. Frisk.
Patients can also request their medical records to be sent here ahead of time if they've scheduled a new patient visit.
Perfect. And I think we already addressed this, but so you do offer virtual appointments, correct? But that's with your established patients. Am I correct?
Yes. It kind of depends. All of us have a little bit of a different preference as to what we're comfortable seeing virtually. But usually it's for things like we're going to review some lab work. We're checking in to see how you're tolerating a medication, things that don't necessarily require us to have to lay eyes on something. But it's more of like let's talk about this sort of thing. And obviously, if during a virtual appointment, if there's something that we feel like, no, we really should see you in the office, we let you know. But it's just to give people some more optionality because, like I said, everyone's got busy lives. And the point is that shouldn't keep you from being able to take care of your health.
Perfect. Another question we have is regarding when to go to the I think you touched on this a little bit in your presentation, but maybe you can reiterate a little bit about when to go to the emergency department versus urgent care and when to see you.
So, easiest way to describe this. So, primary care, we do a lot of the preventative, we do a lot of the acute things as well. So, colds, feeling sick, infections, something looks swollen, not normal, things that you're worried about. If at any point you come into our office and we're like, "Ooh, this is outside of our what we can do here in the office," then we will redirect you to where you need to be. Really, the urgent care and the ER sometimes is a big deciding factor. Our urgent cares are great. They have X-ray ability, so broken bones, that's a great place to go because they can usually do it quicker, get a picture, and kind of see what needs to happen. Again, if they don't feel like it's something that they can manage, they'll tell you to go to the emergency room. But things that typically we say go to the emergency room, kind of my bucket is if your chest hurts, if your tummy hurts, like bad tummy hurts, like I'm dropping to the ground, an adult type of situation, those are go to the emergency room. Or, oh, I lost sensation on half of my body, stroke things, heart attack things, really bad belly things. Those are all emergency room type things because it's just kind of outside of the scope of what the urgent care can handle. Urgent care does more similar to what we do in primary care, where it's the acute things, urinary tract infections, vaginal infections. I broke something, something looks infected. My toenail needs to be taken off, stuff like that, are things that they can handle. And then we can also really, there's a lot of crossover between us and urgent care.
Perfect. I think we have one more question. Alrighty. So our final question for the evening is, how often should a patient see their primary care doctor if they feel healthy?
It really just depends on many factors. If they have medical problems that need to be monitored, like high blood pressure or high blood sugar with diabetes or heart issues, also depends on age. Kids, generally most everyone should be checked about once a year. Healthy kids, healthy adults without chronic medical issues. We want to keep you from having chronic medical issues. With kids, we want to make sure you're growing right and up to date with your vaccines and that kind of thing. With adults, again, it depends on age. Generally, for young, healthy adults without medical problems or medications, once a year seems to be fine, unless you develop something along the way. For older adults that start needing screenings for cancers and cholesterol and other things, probably a little more often, depending on the situation, the age, and the problem. So. Some patients that are very healthy with good labs and blood pressure may only come every 2 years, but that's something we can talk about and come to a mutual decision on. So.
Actually, we have one more question. That was not the last one. You mentioned that you would soon be seeing pediatric patients at your practice. Do you know about how long before you start to see children?
Well, if Dr. Meissner-Frisk had our way, it would be now. My understanding is I think we're looking hopefully in the new year. We're getting all of the equipment and things that we need to set up the office. So we're finalizing some of those things. So right now the goal is for the new year, but the plan is that once that has gone officially fully live, that there will be a rollout of announcements so that everyone is aware of it, so that then people can schedule those appointments.
And actually, to add to that, I believe once we do start accepting pediatric patients, this specific group that attended the session will receive communication about that. So, well, I think that concludes our question and answer session. So, thank you both for such lovely presentations, and thank you everyone for your questions and for joining us this afternoon. Cottage Primary Care Santa Ynez Valley is located at 1992 Old Mission Drive, Suite 140 in Solvang. Immediately following this presentation, you'll receive a link to request more information or to make an appointment with our Primary Care Santa Ynez Valley Clinic. We will also email a recording of this presentation in the coming days. And if you have further questions or would like more information, you can always call 805-686-3200. And to learn more about Cottage Primary Care Santa Ynez Valley or our other primary care locations, you can visit cottagehealth.org/primary care. A brief survey will appear after this webinar closes, and we'd love to hear your thoughts. So thank you again for joining, and have a happy and healthy rest of your day.